finding Kumar with Neuhaus Foot Ankle. Today I'm going to be talking about puncture wounds in the foot. Of course, anytime you have any sort of puncture wound in the foot, we would love for you to come into the office. We definitely want to take a look. Kind of the first initial treatment for puncture wounds, you want to make sure the area is clean. You want to stop any bleeding. And as soon as you've kind of done those first steps, you really want to come in because we need to check and make sure there's no, foreign bodies still in there. We may have to do kind of an in-office little procedure where we just kind of, flush the site, numb you up, make sure, there's nothing kind of deep going on in there, maybe even do x-ray or ultrasound in the office. Sometimes, depending on whether the puncture wound, the amount of time that it's occurred, a deep space abscess can occur. You can get an infection, and that requires us going into the operating room and kind of doing like a deep flush and just really cleaning the area out, making sure there's nothing deeper in the tissues, tendons, or bone. And that's something to be concerned about. Puncture wounds can turn into osteomyelitis, which is bone infection. That's why it's really important to come in right away. Some other things to keep in mind. Whenever you have a puncture wound, you want to think of your tetanus status, and if that's something that you don't remember, we will definitely get the booster and the immunoglobulin to kind of keep you up to date with your tetanus status. And if you have any contact with animals with a puncture wound, you also want to think about rabies and rabies vaccine. So those are just a couple things to remember with puncture wounds. So right away you want to just keep the area, clean it out, stop the bleeding, and we definitely want to see you right away to make sure there's nothing more in the wound, and we want to prevent any kind of deep infection for you. If you have any other questions, you can definitely visit our website and also go to apma.org. Thanks.